Hello students, welcome to All About Nursing channel. So today's video is going to about the nursing care plan on fever. So fever is a common symptoms of any infection. So in patient who have fever, we can write some diagnosis in fever patient. So first, that is hypothermia or ineffective or altered body temperature related to excessive heat production or exposure to high temperature or ambient in temperature. So that can be the nursing diagnosis, that is hypothermia or fever related to excessive heat production or exposure to heat, or ineffective regulation or improper regulation of the our thermoregulatory center, that is hypothalamus. Okay, so the secondary to any kind of disease condition your patient have, so that can be written in secondary to. Okay, so the assessment we can do the checking the temperature, that is elevated body temperature, flushed skin, so patient verbalization, so that can be the means subjective and objective data. Next, nursing intervention or planning, where we can do monitor the temperature every 2 hours, remove excessive clothes or blankets, administer antipyretic medication as prescribed, or apply a cooling blanket or cold compression like tepid sponging we can give. Next diagnosis can be risk for deficient fluid volume. In fever patient, there is after reduction of the fever, there is increased diaphoresis, sweating is there, or increased metabolism is there in fever. There is increased demand in the cells, so that leads to risk for deficient fluid volume. So that is a potential diagnosis, so risk diagnosis. So where we can write the risk for fluid volume deficit related to, that is that can be written like there are different related to we can write. Related to means the etiology, what type of etiology is caused this diagnosis. Okay, so the risk for deficient fluid volume related to we can write that increased fluid loss due to fever, due to the sweating, increased metabolism. Okay, and in risk diagnosis we all know that there is no as evidenced by is there, so there is no as evidenced by, but in case of assessment we can do checking the fever, the temperature that is more than 38 degrees centigrade, that is increased respiratory rate, heart rate. Okay, dry mucous membrane. So the signs of dehydration we can see, that is dry lips, the sunken eyes, there are different signs are there, so that can be written in assessment. Okay, next, in the nursing intervention or planning, we can do monitor temperature and vital signs every 4 hourly, assess for signs of dehydration, that is tachycardia, dry skin, low urine output, and encourage for oral fluid intake, that is more than 3 liter, near about 3.5 liter. And if the patient is not contraindicated, if the patient has heart failure or chronic kidney disease, so there is a restriction of the in the fluid, so in that case we can do that. But if the patient has no contraindication, so in that case we have to provide fluid more than near about approximately 3.5 liter. Next, monitor intake output of the patient, administer IV fluids if patient is severely dehydrated, or if the patient is prescribed for IV fluid. Okay, in that case, and educate the family member for fluid or how to maintain hydration. Okay, and then evaluation, we can check the again check the hydration of the patient, that is if there is any dehydration signs is persisted or not, is there is the reduction of body temperature is happened or not, so that kind of evaluation we have to do. So in fever patient, there is mainly two diagnoses, that is hypothermia and risk for fluid volume deficit. And as a whole, you can see in the first slide, that is hypothermia, risk for fluid volume deficit, and deficient knowledge we can write in patient who have fever.